I'm Lucy Topaloff, and I work at Miraclefeet, an organization that helps doctors in developing countries cure Clubfoot. So we're only 5 years old, but we're already helping to treat 10,000 children in 13 countries. I'm going to present the Miraclefeet brace and show you how it's going to help us treat untreated Clubfoot worldwide. So Clubfoot is one of the leading causes of disability worldwide. It affects 200,000 children every year. It causes the foot to go inward and upward, like in these children, which makes it very hard to walk. So the children on your left were treated in our partnering clinics, but the 17-year-old on your right is too old to get treatment, so he'll have to walk on his ankles his whole leg, which is not only painful, but will make it hard for him to get a job. And 2 million people are living that way, but it doesn't have to be like that. There is an easy and low-cost solution to Clubfoot. It's the Ponseti Method. It's now the gold standard for Clubfoot worldwide. It works in 95% of cases. You don't see Clubfoot in the US because all children are treated with this method at birth. So it just consists of putting casts on a child for 5 to 8 weeks and changing it every week until the foot is fully corrected. And then, like with orthodontic treatment and the retainer, the children have to wear a brace at night for 4 years to keep the feet from relapsing back into the clubfoot position. But even though bracing is so critical, there are only two kind of options. So a cheap but uncomfortable brace, like this one that's made of very hard leather, it's very blistering and just a piece of metal. So I was in South Africa last year and watching mothers trying to put this on their child. So they would put one foot in and then the child would kick and cry, and it was really hard to put the other foot in, so it took over 25 minutes. So imagine doing that every night for 4 years. It creates very high relapse rates. There are also more comfortable options, like the Mitchell, which is on the right, but that costs from $400 to $1,000. And knowing that you need about 5 to 7 braces for your child as he grows, it's completely unaffordable for most parents. So in 2012, we started working with Stanford and our partners in Brazil to really create a brace that was low cost, but also very comfortable and easy to use. So students spend time in our partnering clinics to try and understand from clinicians and parents of children with clubfoot what they really wanted from a brace. And after 2 years of rapid prototyping and getting feedback from the field and going back there and testing, they came up with this brace. So the shoes clip on and off the brace, which makes it very easy to use. The shoes were designed by Clark's Shoes, a leading shoe company, and they are producing this at cost for us for only $6 a pair. The bar was designed by Suncast, a leading plastics company, again pro bono, and they're producing it at cost for $12. Children can stand in the brace, which is like in none of the other braces. And there are 3 sizes of bar, and these are recyclable because they're so sturdy, and 7 sizes of shoes, so that further drops the price of treatment. So do parents really like the brace though? Yes, they do. As you can see, the children are really loving the fact that you can stand in it, though you only need to wear it at night. And children and parents thought it was more comfortable and more practical, so we're really hoping that this will drive the relapse down. We're now going to produce 3,000 braces by the end of May and distribute it to our partners in country. We'll continue to measure the Pirani score, which is the degree of severity of clubfoot, to understand whether this brace is more effective in treatment than the older brace. So we have a very strong business and public health team at Miraclefeet, and we work very closely with our partners in country. And I am the coordinator between these people, but also the producers. So we've raised $80,000 for the hard tooling. We're now ready to go into production. So with $5,000, we would produce 250 braces, and $10,000, we would produce 500 braces to test this on a larger scale. We would then be able to sell some of the braces for profit later on, and that would enable us to give them for free. Thank you.